The Marburg virus. It's a name that strikes fear. This deadly virus causes a severe, often fatal hemorrhagic fever. Marburg virus disease, or MVD, demands our attention. We need to understand the threat it poses to global health. Marburg virus has a high mortality rate. It can spread quickly from person to person, making it a serious concern for public health officials worldwide. Outbreaks can overwhelm healthcare systems and cause widespread panic. Knowing the signs and symptoms is crucial. Early detection can make a life-saving difference. We must all be vigilant in the face of this emerging threat. The world is watching as this virus spreads. We must be prepared, we must be informed, and we must act quickly to contain this deadly threat. The Marburg virus was first identified in 1967. The discovery occurred during simultaneous outbreaks in Germany and Belgrade, Serbia. Scientists traced the outbreak to a group of laboratory workers. These workers had been exposed to infected African green monkeys imported from Uganda. The virus is believed to be zoonotic, meaning it originates in animals and can be transmitted to humans. Fruit bats are considered the natural reservoir of the Marburg virus. They can carry the virus without showing symptoms. Transmission to humans typically occurs through contact with infected animals, which can include exposure to bat droppings or bodily fluids. Human-to-human transmission occurs through direct contact with blood, secretions, organs, or other bodily fluids of infected individuals. Understanding the origins and transmission methods of the Marburg virus is crucial. This knowledge helps researchers develop strategies to prevent and control outbreaks. It also highlights the importance of careful handling of animals and safe laboratory practices. The incubation period for Marburg virus disease can range from 2 to 21 days. This is the time between exposure to the virus and the onset of symptoms. Knowing the signs and symptoms is crucial for early detection and treatment. Early symptoms of MVD can be nonspecific. They may include fever, chills, headache, muscle pain, and a rash. As the disease progresses, more severe symptoms may appear. These can include nausea, vomiting, diarrhea, abdominal pain, and chest pain. In severe cases, patients may experience bleeding from the nose, gums, eyes, or internal organs. If you experience any of these symptoms and have reason to believe you may have been exposed to the Marburg virus, seek immediate medical attention. Early diagnosis and treatment are essential for improving chances of survival. Rwanda is currently grappling with a concerning outbreak of the Marburg virus. The outbreak was first reported in August 2024. It is centered in the southern districts of the country. As of today, October 3, 2024, the Rwanda Ministry of Health has reported over 100 confirmed cases of Marburg virus disease. The outbreak has sadly claimed the lives of at least 50 people. These numbers are a stark reminder of the virus's deadly potential. The Rwandan government has taken swift and decisive action to contain the outbreak. They have implemented strict quarantine measures in affected areas. They have also launched public awareness campaigns to educate people about the virus and how to prevent its spread. The situation in Rwanda is evolving rapidly. Health officials are working tirelessly to trace contacts, isolate infected individuals, and provide supportive care to those affected. Section 5. The difficult road to treatment and containment. One of the biggest challenges in tackling the Marburg virus is the lack of approved vaccines or antiviral treatments. Currently, treatment is primarily supportive, focusing on managing symptoms and maintaining vital functions. This includes providing fluids and electrolytes to prevent dehydration, maintaining oxygen levels, and managing blood pressure. Experimental treatments, such as antiviral drugs and antibody therapies, are being explored. However, these are not yet widely available. Containment efforts focus on isolating infected individuals, tracing and monitoring their contacts, and implementing strict infection control measures in healthcare settings. This includes the use of personal protective equipment, or PPE, by healthcare workers. The lack of effective treatments and the virus's high mortality rate underscore the urgency of developing vaccines and therapies. Research is ongoing, but it is a race against time to stay ahead of this deadly virus. Section 6. Echoes of Outbreaks Past. The Marburg virus, while less known to the public than Ebola or COVID-19, is no stranger to causing outbreaks. It belongs to the same virus family as Ebola, known as Filoviridae. Both viruses cause hemorrhagic fever and share similar symptoms. The current outbreak in Rwanda serves as a stark reminder of the 2014 to 2016 West Africa Ebola epidemic. This outbreak claimed the lives of over 11,000 people. It highlighted the devastating consequences of a highly contagious and deadly virus. While the Marburg virus has not yet reached the global scale of the COVID-19 pandemic, its potential to spread rapidly and cause significant mortality cannot be ignored. The world has learned valuable lessons from past outbreaks. We must apply these lessons to the current Marburg virus outbreak. This includes strengthening healthcare systems, improving surveillance and response mechanisms, and increasing public awareness. Section 7. Protecting yourself and others. If you are traveling to or working in areas affected by the Marburg virus, taking precautions is crucial. Avoid contact with bats and other wild animals. Practice good hygiene, including frequent hand washing with soap and water or an alcohol-based hand sanitizer. Avoid contact with blood and bodily fluids of anyone who is sick. If you are caring for someone with Marburg virus disease, wear appropriate personal protective equipment, such as gloves, masks, and gowns. Be aware of the symptoms of Marburg virus disease. If you develop fever, muscle aches, or any other symptoms within 21 days of being in an affected area or having contact with someone who is sick, seek immediate medical attention. Protecting yourself also means protecting others. By taking these precautions, you are playing a vital role in preventing the spread of this deadly virus. The UK government recognizes the global threat posed by the Marburg virus. They have pledged their support to Rwanda and other affected countries. This support includes providing financial assistance, technical expertise, and medical supplies. The UK is a leading contributor to global health initiatives. These initiatives aim to strengthen healthcare systems and improve disease surveillance and response capabilities in vulnerable countries. The UK's commitment to global health security is evident in its rapid response to the Marburg virus outbreak. They are working closely with international partners to contain the outbreak and prevent its spread. The UK government is committed to working with the international community. They aim to prevent future outbreaks and protect people from this deadly disease. The World Health Organization, or WHO, is at the forefront of the global response to the Marburg virus outbreak. They have declared the outbreak a public health emergency of international concern. This declaration is a call for international collaboration and resources. The WHO is working closely with the Rwandan government and other partners to coordinate the response effort. This includes providing technical guidance, deploying experts to the field, and supporting surveillance, contact tracing, and infection prevention and control measures. The WHO is also leading efforts to accelerate the development of vaccines and treatments for Marburg virus disease. This includes facilitating clinical trials and working with manufacturers to scale up production of promising candidates. The WHO plays a crucial role in coordinating the global response to health emergencies. Their leadership and expertise are essential in containing the Marburg virus outbreak and preventing its spread to other countries. We are all part of a global community. This means that we must remain vigilant in the face of this emerging threat. We must stay informed about the latest developments and follow the recommendations of public health authorities. Pay attention to travel advisories. If you are planning to travel to affected areas, consult with your healthcare provider about the risks and necessary precautions. Be proactive in protecting yourself and others. Practice good hygiene, avoid contact with sick individuals, and seek immediate medical attention if you develop symptoms. By staying informed and taking appropriate precautions, we can all contribute to the global effort to contain this deadly virus. The Marburg virus outbreak is a stark reminder of our interconnectedness. Diseases know no borders. What affects one part of the world can quickly become a global concern. This is a time for global solidarity and cooperation. We must work together to support affected countries, strengthen healthcare systems, and invest in research and development for vaccines and treatments. By working together, we can overcome this outbreak and prevent future ones. We must remain vigilant, informed, and united in our response to this global health threat. The Marburg virus is a challenge, but it is a challenge we can overcome. Let us face it with courage, compassion, and a shared commitment to protect